Hey guys, it's been a while since I've done a live video, so I thought it would be a good opportunity since I just went to the eye doctor today and there's some new developments. So I titled this Keratoconus and Epiretinal Membrane, and I know neither of those make any sense to you, okay? So I'm going to explain what that is. So keratoconus is a condition of your cornea. Your cornea is the very front layer of your eye, okay? So keratoconus is when there's thinning of the cornea and the easiest way to think of it, the rest of your eye kind of bulges forward, right? Mine isn't full-blown keratoconus. It's called ectasia, which means that I'm not full-blown yet, but it probably will be. Now, why I'm telling you this, your cornea is a tissue, okay? So they've noted it before. It's also noted under stromal thinning. Again, same thing. They've noted it before, but today we actually did a little something about it. I'll get to that. An epiretinal membrane, okay? So you know what your retina is. It's the very back lining of your eye, okay? Epi means above, okay? So above the retina, okay? So your membrane, an epiretinal membrane means that over your retina, there, and your macula especially, which is the main center of vision, where if you have 20/20 vision, that's where it comes from. If you've ever had a picture of your eye and you see like a big thing that looks like a sun and then all your nerves and then kind of like a white dot over here, that's your macula. So in fact, it's not generally centered completely. So basically an epiretinal membrane means that above your macula, which is in your retina, there's scarring, which it's mainly in my right eye. I've had 3 surgeries in my right eye as opposed to 2 in the left. So that makes sense. And on top of the scarring, there's wrinkling of the tissue. Again, why am I telling you this? Because it's tissue. So if you ever go to the eye doctor and they say that it's not Marfan related, I've told you this before, most things I have a really, really hard time believing isn't, because your whole body's made up of tissues. How is it not connected, you know? So those were the 2 big things, words, terminology I wanted to first explain before I went any further. You really can't tell much from these, but I'll show you anyways. This is your macula, called an OCT. And this is your nerves, your optic nerve, okay? Also an OCT. Something to note about my optic nerve, I've had a, what is it called? They also do it for your heart. It basically runs stuff through your veins and your arteries to see how the blood is flowing. I can't remember off the top of my head what it's called, but I did that in my eye, which is super weird. But they noted then and also now that my veins are very small and they're also very taut, or, you know, daggone near tangled, which at the moment isn't an issue, but it could be. It could cause damage and lack of blood flow if that got worse. Okay, so there's a little note on the optic nerve as well. Okay, so we know that my vision is bad. That's a no-brainer. It has been my whole life, right? And I've told you before that I have a real big issue, and there was actually a sign at this place, which, yeah, I have a real big issue with the digital eye exams that say that they don't need dilation. There's a lot of issues with that, mainly because it's a guess and the patient has zero input on what their prescription, treatment, anything. They don't have any say-so whatsoever or input, okay? I have a real big issue with that. So, where was I going? Oh, so the thing is, I've been telling you the patient needs an input. For years and years and years, I can remember telling them, I understand that you can't find a reason why I'm not seeing how you think I should be seeing, but I'm not. Can't tell you why, don't know why, but I'm not, right? So therefore, that is something that you can't do with that digital exam, okay? Now, for somebody that has 20/20 vision and they just need something minor, or they have 20/40 and they just need their contacts or something like that, then maybe. I still wouldn't recommend it, but maybe. High, slight, maybe. Anyways, so today, when he was talking about my cornea, going back to the ectasia or the keratoconus, okay, that actually, once everything starts bulging out and thinning, causes disruptions in your vision. Now, is this a new thing? No, it's been noted several times, and no one has connected the dots to see, you know what, maybe, let's look at this a little closer. Maybe that's why she has so much unexplained vision loss. We know a lot of it is from amblyopia, which is, you cannot, no matter what you do, correct the vision to 20/20. It's impossible. A lot of that reasoning is because I went without lenses in my eyes for 11 years. Your eyes become super, super weak at that rate. You also form a little bit of strabismus because they are so weak. Strabismus is when your eye turns one way or the other. Mine's not that bad until I'm tired. Same with nystagmus when I'm tired. Nystagmus is the swishing. So he thought, okay, let's look at this. He did a little test, and then he had somebody come in with rigid gas permeable contacts. Okay. Now, as most of you think of contacts, you think of the pliable ones that you can flip either way, even though you're not supposed to. You can, they can rip. They're pliable, easy to maneuver, all of this, right? That's not the only type of contact that there is. Rigid gas permeable, think of it basically as a hard contact. It's come a long way from when I first started learning about them, like a really, really long way. There's actually materials that you can get if you want to sleep in them. I still don't recommend that because it's not healthy for your eye, but if you do fall asleep in them, it's not going to be the end of the world as if it was years ago. So, this rigid gas permeable contact, basically, do you know how when you get a corneal abrasion, they put a contact over it? Kind of the same premise. This contact, because it's hard, for lack of a better explanation, holds everything where it's supposed to be to keep the vision stable as long as it's on there, if that makes any sense. So you wear this gas permeable lens that, like any other contact, has a prescription in it. But a gas permeable lens, most people that wear those will tell you that the prescription is much better, that they can see much better. The downfall for most people is that it's not extremely comfortable. Now, for most people, they can't wear it at all because, you know, their eyes are super sensitive or their pain tolerance is low or what have you. He actually numbed me first, which he didn't really need to, but he did. And then he put it in. So when the numbing was wearing off, he said, well, how does it feel? And I said, just feels like, you know, a foreign body, nothing And he said, it's funny that you're sitting here having a conversation with me because most of the time people are screaming, get this thing out of me right now. I said, well, you know, I've had a lot in my eyes, fingers, instruments, operations. This is kind of minor. It's not super comfortable, but it's minor, you know. I can live with it. So the doctor comes back in. This was a tech. And he was doing an over refraction because they don't, as opposed to soft contacts, they don't carry all prescriptions in hard contacts. They don't get a whole wall of variety, okay, because they're more expensive and lots of other reasons. Not as many people use them. So the doctor comes back in and he said, you know what? Your vision went from 2,500, which if you know anything about legal blindness, it's 2,200. Okay, so before, when I had nothing, I was at count fingers. So that means instead of seeing the eye chart at all, they had to go back and how many fingers do you see? Okay, so he went from 2,500 to 2,200 and 2,250. Again, that's not excellent, but it's a huge difference, like major huge. Okay. It is very interesting that no one in 30 years, I started my vision journey basically 30 years ago, that no one has ever said anything about hard contacts, ever. And I even worked in eyes, and no one said anything about it. The downfall is my main insurance actually switched the vision part, and I didn't know about it. So I don't know that I'm actually going to be able to go through with this plan, because to pay out of pocket is very expensive for the fitting and the contacts and if your vision insurance doesn't cover it. And the vision insurance that I have now, they don't accept. So I don't know that I'll be able to go through with it at the moment. However, that is planted in my mind, and if and when they do accept my insurance or I change insurances, I'll go through with that. Okay. I'm telling you this because I know at least one other person in here has corneal issues. Okay. If you're going to a doctor and they cannot figure it out, are you talking? My eye visit today, Leslie. If you're going to an eye doctor and they cannot figure out why you have unexplained vision loss, maybe mention gas permeable contacts or hard contacts to them, and maybe mention cornea, just corneal thinning maybe, and see what they say. Now, if they don't entertain that idea, my doctor is Potwin in Charleston, if you're in West Virginia. He's also in Beckley, West Virginia, and he is a corneal specialist. Okay, the worst thing that can happen is that you go through this process and it doesn't help. Well, okay, you're back to where you started because it wasn't working anyways. And when you have corneal damage, your vision decreases. It just comes along with the package. So maybe, even if I can't go through with this process as of now, maybe it's giving you some ammo to put in your tool belt so that next time you go to the eye doctor, you can say, hey, what about? Whether they listen or not, that's up to each doctor. But that gives you a little bit of ammo to be armed with. I will probably have to just go with glasses. My prescription didn't really change that much. He did increase my bifocal again. So in the typical glasses, the highest you can go is a 3. I went up last year to a 350, which was a huge, huge improvement. So we did a little testing on the better or worse. Click, 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 click. Better or worse. It is called the 4-opter. and we put it up to a 375, and that was actually even better. So if I do get new glasses, that will go up. Depending on insurance again, who knows, I might just stay with these, and they're not that much different. So that wouldn't be the end of the world. But we did learn a lot. I'm always adamant about having your yearly dilated eye exam. Now, I know some doctors, it wasn't the case with mine, but I know some doctors are prescribing you dilation drops so that you can dilate before you come because of all this COVID crap. They don't want to get the same bottle that they're using on everyone that close to your eye, because your eye is a mucous membrane. And if you followed anything about science in the last, 7 months or so, you know that a mucous membrane is where the things come in. Your nose, your mouth, your eyes. That's the main 3 mucous membranes that you get sick through, whether it's COVID or just a regular, flu or something. Did you go in? Yes, I did. I went in dilated. So they don't like to use that. That's what she's talking about. I was talking to her about dilating before I went. I have dilation drops because when I had so many surgeries, I was dilated for over a year straight. So even though my doctor didn't write prescriptions and tell you to go dilate, I knew that I didn't want that bottle that's close to everybody else's mucous membrane close to my mucous membrane. And if I had the medicine already, why would I not? So I did. And also it made me remember when I have pain sometimes when I look far left, far right, when it gets to that extreme. I told him, I said, if I dilate my eyes sometimes, it helps. And he said, you know what? That makes perfect sense, because with the little bit of nystagmus that you have, when you're looking extreme left, extreme right, and you hit pain, your eye wants to start twitching, right? Twitchings, nystagmus, and all that. When you dilate, it basically paralyzes that muscle, so it gets rid of some of that pain and lets you look far left, far right without as much pain, or maybe any. Okay, so he re-upped my prescription because mine was like 5 years old. That's another little food for thought, because some people do have eye pain, and most of the time it's completely, you can't figure it out. Why does it hurt? That's, people have looked at me like I'm crazy for the last 8 years. Like, I don't know why your eye hurts. And I'm like, I don't either. So that could be some of it. Thank you, Joe. I appreciate that. That could be some of it. If it helps at all, I'm all for it. A lot of people think that if you get dilated, you can't drive. That's a misconception for the most part. The main part why they say that you can't drive is because you're sensitive to light. More so than normal, obviously. But your distance vision, as a rule, is not affected when you're dilated. It's mainly your near vision. So, I don't know about any of you, but I don't really use my near vision when I'm driving. So, that shouldn't be an issue. A lot of times people use it as an excuse to not get dilated. And that's a whole nother soapbox that I won't get on, because I think you know my views on dilation by now. It's very, very important. Most of the stuff that we just went over, you would not see if you were not dilated. Okay? So, if you want to know any of this stuff about your eyes, you need to be dilated. It might be uncomfortable, but get over it. Suck it up, buttercup. You'll be fine. Okay? So, I think that I went over everything, other than he notes on here that my IOL intraocular lens, which is my lens implant in my left eye. Again, I said I have had 3 surgeries in my right, 2 in my left. My left one is in need of another surgery, and It's basically a waiting game to wait until it's loose enough and out of place enough to warrant surgery. Risk versus reward type of deal, right? But he does note that it is loose. So basically, when he's looking in the slit lamp, which is the light with the magnifying glass and all that, he sees it moving. Not wonderful, but it is what it is. I knew that already. Yeah, I think that's all. If you have questions, I know I just threw a lot at you. You know, a little bit of verbal vomit education. I'm good at that. If you have questions, let me know. If you want any more videos like this, let me know. I haven't done one in a while just because I wasn't getting an extreme amount of interaction per se. But if you like these and if you learn from these, let me know, because I do enjoy doing them and I will be happy to serve in that way. You guys have a great day. Thanks for listening.